11 Alive News at 6 p.m. starts now.
We're going to have to really be prepared because it's going to get worse before it gets better.
First at 6, Metro Atlanta doctors are warning patients and children could be in for a few rough weeks as we deal with the surge in flu and respiratory viruses right now. So many children are getting sick that some urgent care centers and emergency rooms are at full capacity.
And that's forcing them to turn patients away. 11 Alive's Joe Ripley reports from Stockbridge about the long waits at the children's facility there.
We're barely a month into flu season here in Georgia, which runs through about May, according to the Department of Public Health. But many parents are frustrated, unable to get health care access for their kids.
My 4-year-old is actually nonverbal. So when he gets sick, it's always at high concern because he can't really voice to us how he feels.
Rashonda Timms, pediatrician, no longer offers walk-in appointments. She tried to get help for her 4-year-old at Children's Urgent Care in Stockbridge, but couldn't make it through the line wrapped around the building.
Sometimes just sitting in the waiting room, that's going to make your child even sicker because you're sitting in the waiting room with all these other sick children.
And that's if you can make it inside. This location and others have been unable to accept patients at times because they're at full capacity, according to staff. Children's Healthcare of Atlanta told us its emergency apartments and urgent care centers have been experiencing extremely high volumes at all locations due to a surge in respiratory viruses. DPH reported at least 1,500 flu cases across the state in the last 2 weeks, and RSV is landing kids in urgent care centers or hospitals.
It costs more for families to go to urgent care centers and end up in the emergency room and then be admitted to the hospital than to provide basic services and basic needs. So until we fix that dynamic, we're just going to see this over and over again.
Dr. Cecil Bennett with Noonan Family Medicine suggests some common practices to prevent emergency room or urgent care visits.
Wash their hands. If they're sniffling, make sure they have something to wipe their noses with. They use hand sanitizer.
But in cases like Kenesha Jackson's, it's not as easy as it sounds.
When you're dealing with like the cost of gas, the cost of not even being having to be able to afford to put gas in the car to get to the places that are local. So yeah, it is a little harder.
In Stockbridge, Joe Ripley, 11 Alive News.